Hello. The number of confirmed cases of the novel coronavirus in China is still on the rise. Meanwhile, WHO just declared the outbreak a global health emergency. How do we understand the implications of the decision? What are doctors and researchers and medical staff doing to fight the virus? What other measures are needed? And what are the short-term and long-term impacts on the global economy? To discuss these issues and more, I'm joined in the studio here in Beijing by Hu Naijun, Associate Professor of the School of Public Policy and Management at the University of Chinese Academy of Sciences. Welcome. And also we'll talk via satellite to Chen, Assistant Professor of Health Policy and Economics at the Yale School of Public Health, and James Chao, World Health Organization Goodwill Ambassador and host of China Current, and also Tang Bo, our reporter in Wuhan. That is our topic. This is Dialogue. I'm Zhou Yuan. Let's first talk about the WHO's recent meeting, Dr. Hu. The WHO has just declared the outbreak of this new coronavirus as a global health emergency. How should we understand the decision? Actually, they had a meeting several days ago, decided it was not a global emergency. But why did they change the decision on that?
Yes, WHO has just declared a kind of public health emergency with international concern. However, the director of WHO has stated very clearly that this kind of emergency is not targeted on China alone. It's targeted on the other countries who have, I must put it to say, some less capacity of dealing with public health emergency problems, such as some small and poor countries. So from this statement, I can see that WHO has confidence in China because the declaration is targeted on other countries. So I think this is a kind of show that WHO has the confidence China will have the victory to fighting against this kind of new virus.
Okay, I want the take of James Chao. He is the World Health Organization Goodwill Ambassador and host of China Current. James, what do you make of the decision of the WHO on the recent status of China as a global health emergency because of the outbreak of the novel coronavirus? What does it mean for global trade and global travel?
Well, first of all, I trust that decision because Dr. Tedros and WHO, they're specifically tasked to handle these kinds of emergencies each and every day. It doesn't indicate anything for trade and travel restrictions. In fact, in the past, when you look at Ebola back in 2014, when WHO was asked to shut down borders over in West Africa, they said absolutely no, that can't be the case. And when I spoke to Margaret Chan earlier today, she said the same. But when you look at this public health emergency of international concern, what it really does is provide a framework and it activates that framework, that process, so that member states can really work through a joint and coordinated action. What it does is, one, it issues specific recommendations so that these member states can work together, but also at the same time it specifically says that member states should not take excessive action. So in a sense, what WHO is able to do is to monitor and engage all its member states to make sure that the right actions are taken at the right time. And as you said there, a couple of days ago, they didn't declare this emergency. A couple of days later, they did. And I think that's just an indication of how fast-moving all of this really is.
And the Director General especially mentioned this is going to be a challenge with those nations without sound healthcare system. What exactly does it mean by that?
Well, I mean, he made it very clear that, as your guest said just there, this is not about China in a sense. I would actually add one word. It's not only an investment of trust in China, but also confidence in its leadership, in its health workers, that is able to control the epicenter of the outbreak in Wuhan going outwards. But it's very much an acknowledgement that there are varying degrees of strengths of health systems all around the world. And some of them, he says, are very ill prepared for an outbreak of this kind. I took part in the global preparedness monitoring board launch back over in New York in September, where Gro Harlem Brundtland, a former WHO Director General, said very specifically with Dr. Tedros that our world is at acute risk of disease epidemic epidemics and pandemics. They're going to cause a loss of life, they're going to upend economies, they're going to create social chaos. So what he really is doing over here is trying to avoid that. And what we need to do now is to go beyond this, to say this is another wake-up lesson for the world, to really be prepared in the systems, to adequately fund them, so that outbreaks or not, we are able to deliver on health for people.
And he actually thanked for China for its efforts in containing this new virus, saying that there is only 100 cases outside China. Already in China, there is more than 10,000 cases, nearly 10,000 cases. What do you make of the discrepancy of numbers?
Well, if you look at the infections and also at the numbers of fatalities, most of them are taking place in and around Wuhan and Hubei province. And when you look also much further afield, I think what he's doing is looking back to SARS. A lot of people look at SARS and they say there's evidence of China not being able to work well with the international scientific community. But in fact, the way it was able to transform that response, the way it's been able to progress since then, is exactly what this public health emergency of international concern is all about. It opens up the floodgates, not only to expertise, but also to knowledge and also to data. And it basically ensures that there's a thorough international exchange for this to happen. And I think that's what's going to have to happen with this as well.
All right, let's turn to our reporter, Tang Bo, who's been following that from the epicenter in Wuhan. So, Tang Bo, do we know that there is enough medical support, doctors, and beds to handle the sudden surge of patients in Wuhan?
Well, Zoe, medics in Wuhan have described overcrowded hospitals and a shortage of protective gear and other medical equipment. And that's the major reason for the city authorities to build 2 new health facilities, Huoshengshan and Leishanshan hospitals, to alleviate the pressure. When completed, the 2 new hospitals will be able to host over 3,000 patients. And as far as I know, for now, all designated hospitals for treating the pneumonia are fully packed. And medical workers, especially those respiratory and infectious diseases doctors, have been working day and night to combat the epidemic, and measures have been taken to alleviate the hospital's burden. For example, Wuhan's Tongji Hospital, right behind me, has launched an online outpatient service for those who thought they have got infected by the new virus. And we have entered the flu season now, and many people catch cold or gut fever. So when their body temperature goes up, they then rush into the hospitals that are already overcrowded due to the outbreak. That highly increases the risk of cross-infection. So the online service is able to let people communicate with doctors of the hospital directly online, and that saves a lot of time, releases the burden of the hospital, and reduces the risk of more infections. You can even upload your CT pictures so that doctors can make further diagnosis and tell you what to do next.
And earlier you mentioned the 2 makeshift hospitals, the Huoshengshan and Leishanshan hospitals, and Wuhan promised to build them in 10 days. They're supposed to be up and running in the early February. Can they be happening as scheduled?
Well, I went to the construction sites of those facilities, and I was very much impressed by the rapid progress made by constructors who have been working there day and night in 3 different shifts. And for Huoshengshan program, the foundation works have been completed. Builders are now busy with assembling hospital wards and other units. And for Leishanshan program, the land leveling works are finished. Waterproofed and impermeable layers have been well paved. And Huoshengshan Hospital is due to open on February 3rd, and the other one on the 5th. Building a hospital from scratch within 10 days is not the first time in China. Back in 2003, Beijing authorities built the Xiaotangshan Hospital to respond to the SARS epidemic. It successfully treated 1/7 of the SARS patients in China. So I am quite confident that the 2 new hospitals will be operational on time.
All right. We'll probably be signing a sigh of relief for that. Thank you very much, Tang Bo. And let's talk to Dr. Chen Xi. He is the Assistant Professor of Health Policy and Economics at Yale School of Public Health in Connecticut in the U.S. So, Mr. Chen, where we are in terms of this fight against the new coronavirus?
Yeah, this virus outbreak was very much caught us off guard, and it spread very quickly, and it's very contagious, and the virulence of this virus and the origin of this virus is still unknown. So looks like the death rate is lower than SARS, but more people are infected at a very fast speed. So we have very limited time to respond. But I think since the release of information about the human-to-human transmission, so the government was taking very much measures like the lockdown of the major cities. And yesterday there was some evidence showing that the lockdown take effect because they find a lower number of reproduction number, which means that people who were infected tend to infect fewer people. So the number is going down. So that's great. And also, Chinese government wanted to extend the holiday season in order to pass the incubation time to make everyone safe. And they also take very concrete measures in health policy, like insurance reimbursement, and also the tiered care system to screen people before they flood into the hospital.
And a lot of people are asking the same question. Are we approaching the turning point? Because over the past 10 days, we've seen cases jumping from 100 to 10,000. What do you make of the speed of the infected cases in China?
I think from the current data assessment shows that it's still on the rising, but we are closer to the, we call the plateau of this infection. So we see more fluctuations in the trend of new confirmed cases and new suspected cases, which is a good signal because that means we are closer to a more stabilized point where the new cases will be gradually stabilized and before they are reducing. So we are closer and we should be confident, although that will take some more time, could be like a week.
And also, a lot of people worry about the phenomenon of some people might not show any symptoms but still could carry the virus and they could be spreaders. How concerned are you about this?
Yeah, I would say this is really indeed a concern, but I would say most of the cases currently are having symptoms before they are infecting others. So I think a good way is to enhance the health education to health behavior of individuals to have the correct way to wear face masks and also frequently wash hands. Those avoidance behavior of protection will reduce the chance of being infected by those without a symptom. And this is also the concern for different countries. And in the US, in Europe, they also find a little bit case about asymptomatic cases. So they are taking measures. And if that's the case, that the patients should stay at home and being screened before they go into the hospital. So they should take more cautious measures in order to avoid all people going to hospital and cross-infected.
As you said, the epicenter of Wuhan, with a population of 11 million people, are now in lockdown. And also the central government is encouraging people all over the country to have minimal travel. How long do you think this kind of a restriction movement will be in place in this mass and populous country?
I think a very critical time point was the starting date of the lockdown. That means the last group of people living in Wuhan. So they will have an incubation time period, and that takes time for those who develop symptoms. So so really depends on the length of incubation. And the incubation time could according to the current evidence, it could last from 4 days until like 10 days. So the early February would be very dangerous for those individuals to be developing any symptom. So I would say could be like a little bit later than February the 2nd, which is the end of the public holiday. So I think the government may already consider about like even extending some of the more days for these public holidays, especially for some occupations, and the government may streamline the flu back of the people who are living Wuhan, because that will reduce the tension to the traffic transportation system.
But that lockdown happened only on January the 23rd, and Wuhan's mayor said 5 million travelers already left the city before the lockdown, and they are stranded in different places all over the world. And they are actually trying to stay quarantined, but still, how worried should we be when these people are moving back to their city or moving elsewhere?
That's a great question. So when they return back, they already passed the incubation time. So they should be safe without transmitting disease to others. So we should be more worried about like stigma. So yesterday, the WHO Director General mentioned that we should have more solidarity instead of stigma. So so that means we really need to treat them without discrimination. And one more thing I worried a little bit about is those 5 million people, many of them went back to their home county, the villages. And we know that rural China is a weak point for infectious disease. We should monitor not only urban, but keep a close eye on rural counties. That's very important.
And James, I know you also wrote a piece on that, because the disturbing cases of many people in Wuhan and Hubei were treated as virus spreaders, although they don't have proof of whether they are infected or the incubation period has already passed, and people are simply scared and want to keep away from those people. What do you make of those discrimination, and what should the public policy be about this?
Well, I think the government has one big job ahead of itself to educate the public, and as Dr. Chen said just there, the stigma is very painful. Dr. Tedros said this is a time for science, not for rumors. This is a time for stigma, and not for stigma, but solidarity. And, you know, we've heard all the stories about the villages, about self-appointed vigilantes who are blocking entry points to their villages so that people associated with Wuhan, who may not necessarily have been there, are being barred from entry. If they do go into their villages, they're having hate symbols or hate language or big signs strapped across their front doors. And in a way, what you're repeating is the stigma that people living with HIV went through and continue to go through, what people with leprosy and other neglected tropical diseases have gone through. And it creates a very, very unhealthy pattern, because during SARS we saw how rumor and misinformation undid the good work of health workers and health authorities. Now, when you look at SARS, that was back in 2003, Twitter wasn't even in existence then. Now we've got Twitter, we've got Facebook, we've got WhatsApp, we've got Weibo, we've got WeChat. And so it's very, very important at this time to consider your sources of information, to make considered decisions. And I think also, really, no matter how much information a government can throw at you, you really got to have some compassion. You've got to exercise what's in your heart as well as in your mind. You need to take the necessary, understandable precautions for yourself, because when you protect yourself, you're protecting those closest to you, those around you, your family members, your children, your loved ones. But at the same time, you really need to stop this chain of stigma that's already beginning to emerge very quickly. It's not only there, but we're seeing it in overseas Chinese communities in Canada, in France. It's very, very unhealthy.
All right. Mr. Hu, nobody saw this coming, but it will be a big test on public institutions and the government. What do you think that might be improved in terms of public administration in this country?
Well, there are, I'm afraid, a lot of issues and topics on this issue. But I think the first important one is the information sharing procedure. Because as we all know that during the whole process, we can see the information is very important. The two experts have also stated that rumors right now have some effect. If we want to kill rumors, we must have the real information to be shared with the public. However, during the process, we can see that what is the real procedure of public information sharing process is not clear. Some people will say the local government, the CDC, the central government. Right now, we do not know the exact procedure of the information sharing system. And we are also talking about...
And everything is developing so fast.
Yes, that's right. And we are also talking about discriminations and kills. If people do not possess enough information, they will feel a kind of discrimination or kills. For example, if people related to Wuhan, not from Wuhan or just travel to Wuhan, if they are discriminated, they will have some kind of feelings that are fears or shaming of themselves. They will not tell the real information to other people. This is what we call a kind of asymmetrics or moral hazard or adverse selection in any kind of public health policy procedures, because if they are not encouraged to give the real information, then it will make things worse. So I think during the whole process, our government, our media must tell our people, do not discriminate any people, but to give them kind heart, to help them to give out the real information, because only they themselves know what is real about their own health, about their own body, about the procedure of their travels.
I want to talk a little bit about the treatment and also the vaccine story. So Dr. Chen, it seems that vaccine is still several months down the road. So medically, what is the best way to treat those patients? And can the medical facilities handle tens of thousands of patients right now?
Yeah, I think currently the healthcare system is overwhelmed, and there's no effective cure, and the vaccines need to be developed at least in a few months' time. But there was encouraging news yesterday because of the declaration of the emergency of international concern. So that will accelerate information sharing, collaboration in scientific world to fasten the development, R&D of vaccination and any kind of therapeutics. So far, it takes time because they need the animal test and also human test. But it will fasten this process. I heard they will. The news is that they will be developed within the next couple of months. And the encouraging news is with the WHO and the global community coming in, joining this initiative, more and more pharmaceutical companies are joining, and the founders, donors are trying to fund those kind of research and development.
Can you please help us better understand the mortality rate and also the discharge rate of those recovered? There are only more than 100 patients have been treated and discharged from hospitals, and nearly 200 have died of the disease. What do you make of those numbers?
So far, the number of deaths is still too early to say the final death rate, because statistically it's small and may not have very much statistical meaning at this moment. And more severe disease will be treated and discharged later, so the number is quickly developing. But from the current understanding is that this virus is less virulent, but more contagious. So we will have a quicker increase in the suspected cases and confirmed cases. But the death rate will rising, but not to keep at that faster speed.
And we actually been there before. 17 years ago, China witnessed the outbreak of SARS. But in terms of medical care system, in terms of scientific research capabilities, is China better off than 70 years ago?
Yes, I agree with that. And also after SARS, the China CDC developed a system, they call it surveillance or early warning system of infectious disease. So the system was linking the local hospitals with the CDC directly. So any infectious disease case, about 5 cases, then they are able to trigger this they have to press a button or fill out some information, then the national level CDC will receive it. But I would say that we still need to strengthen our primary care system. In the last 10 years, China just celebrated a 10-year anniversary of new healthcare reform. But that reform mostly focused on empowering hospitals. So we still need time to develop the integrated care system to empower local care. So then people will have a better care location to treat those milder symptoms instead of flooding into the hospitals, which will be very dangerous for this infectious disease. People can be cross-infected.
And very briefly, what worries you the most and what encourages the most at this moment?
So what worries me the most is uncertainty. I think this disease really brings us quite a lot of disease, and not only for China, but also the WHO Director General mentioned. So I think that's part of the reason he was announcing this emergency yesterday. But what encouraged me the most is that the government really take timely measures to share the gene and of the pathogen, and also very stringent measures to lock down major cities to cut the flow of transportations. That was unprecedented. Otherwise, we would be in a worse situation.
And James, this obviously created a lot of confusions and distrust among the public, not only in the world, not here in China, but elsewhere in the world, about public health. And it will be a big test for the international community. What do you think the world will handle this crisis? How?
I think that we as human beings are very flexible, but sometimes we are very arrogant. We refuse to listen to the lessons that history has given us. Just 2 years ago, it was the 100th anniversary of the Spanish influenza of 1918 that infected 500 million lives and could have killed up to 100 million of them. I appeal to anybody listening right now, put aside your panic, listen to the information, go to WHO, whichever sources work for you in your local health departments, and follow that bit of advice. And also look at the hope that science can progress. It's incredible that we could produce a vaccine perhaps within a few months, maybe even within a year, and to use that to better understand other outbreaks. But preparedness is going to be key.
And Mr. Hu, there is also economic consequences of this. We don't know how long this will drag on, but what is your estimate of the economic impact of this on China and the rest of the world?
Well, I think it's still too early a stage to make accurate estimation about the impact on economy. But I think during the whole process, the first quarter's GDP and other kind of productions may affect it. But I think in the second quarter and in the third quarter, when our economies after this kind of virus can be recovered from the second and third quarter. And as to the world, I think it is not a very big amount of impact, because right now we do not see any kind of shutdown of the border, of the cargoes, of the trade.
And very briefly, I want you to respond to the U.S. Commerce Secretary's Wilbur Ross' recent statement saying that this might help the United States because jobs will return to the U.S. because people worry about the virus here in China. What do you say to that?
Well, I can't say that the virus itself can help this transition, but because of the human dividend transmission, because China's labor force is decreasing and the cost, the wage of the China's labor is increasing. So there can be kind of transition from labor input or output, but it has not very direct relations with this kind of virus.
Maybe it's not appropriate to say that at this particular time.
Yes.
Thank you very much,
Thank
Mr.
you.
Hu, and thank you, James, and also Mr. Chen. You've been watching Dialogue here on CGTN. I'm Zoe in Beijing. Thanks so much for watching. Goodbye for now.